Now to the battle against COVID-19 here in our community. Vaccines are now plentiful. The push is on to get more people to sign up to get the shots. And joining us with her insights, Singing River Health System's Dr. Priyanka Srivastav. Thank you for joining us here on the 4 o'clock show, Doctor. And the latest numbers from the health department showing about 1.6 million total doses of the vaccine have been given out in Mississippi, and about 25% of the total population in the state have now been fully vaccinated, but still a lot more work to do as we continue to drive those vaccinations, right?
Yes. And we continue to see that trend of decline of COVID cases in our clinics. The ICU admissions have declined, the inpatient admissions have declined. So overall, I think the vaccination is working really well. Singing River is playing a huge part in this vaccination, especially in South Mississippi. We have a lot of Moderna and Pfizer vaccines to offer. So I strongly encourage everyone to get vaccinated because it shows that, it is working. That's why the cases are declining.
And the hospitalizations, lower hospitalizations, are, you see, a direct result of how many vaccinations are being given out, don't you think? How about how many hospitalizations or patients in the hospital right now at Singing River are being treated for COVID?
I think there are only about 6 inpatients at Ocean Springs Hospital, and as we go day by day, it's decreasing. The cases have been decreasing. My husband is a pulmonologist, intensivist, and he's very happy working in the ICU now. I don't see that stress anymore. So I strongly encourage people to get vaccinated. It's working. It's really working. Don't get scared with what the vaccination is going to do, because what the COVID can do is much worse than what actually the minor side effects of the vaccinations.
Now, early on, after the vaccines were just released here in Mississippi, we saw long lines. How different is that now? Is there much of a waiting period at all if you wanted to get vaccinated?
Oh, no, it's pretty quick. We are offering these Pfizer and Moderna vaccine through all of our clinics. We have 10 clinics. You can just call our clinics and schedule an appointment. And so far as I know, it's pretty quick.
Now, this is a question I've gotten a lot from people. They've had COVID recently. They might be concerned to get the vaccination now because of any side effects, especially if they've recently gotten COVID. Is there a reason not to get the vaccination if you recently have had COVID within the last couple of months, we'll say?
No, there is no reason not to get vaccinated. What is recommended is that you can wait for 90 days period, especially if you have gotten the Bam infusion. Otherwise, there is absolutely no reason to wait for the vaccination. If you're out of that acute period of COVID and you're out of the infection, please go ahead and get the vaccination, because just having the infection does not provide you the immunity that you would need. You may still get the infection again.
But the recommendation there is to wait about 90 days after infection.
Yes.
All right. We talked about a lot of people are starting to gather in big groups. We've seen different events happening here on the coast and across the region. Is there any sign that those big events are contributing to larger case counts of COVID, or what they call super spreader events? Any evidence of that right now?
Yes. I think it's too soon to drop our guards. We still, at least 75 to 80% of the U.S. needs to be vaccinated and needs to have that immunity before we let our guards down. I would strongly discourage these gatherings. If it's not necessary, please don't gather, because even if you are vaccinated, you can still infect the other person who is not. So, follow the norm that we were doing previously. Wear a mask where it's necessary. Please maintain a social distance and avoid large gatherings and get vaccinated.
Doctor, thank you for joining us here today. Good information from Singing River Health System.
Thank you so much.
Have a